Welcome everyone to 2022 VFS virtual talk shows for seniors, senior citizens, and their caregivers. This is Pratima Penumarthy. I'm the founder and president of Volunteering for Seniors INC Incorporation, and our mission here is the main thing is to reduce loneliness and isolation among elders, help them stay more energetic all through their life. We aim at making sure that seniors blend into our communities without any difficulty. We are, in fact, achieving it through meaningful volunteering. Our aim here is to serve senior citizens in all-inclusive manner, enabling them to live more active, dignified, and healthier life. We at VFS strongly believe that our relationship-based volunteer services are ideal as they provide more benefit for both seniors as well as volunteers. The relationship that is formed between people can provide the warmth and companionship that we all need to maintain a high quality of life. Our main goal here is to connect people to resources that promote aging with independence and increase community awareness of aging issues and generate community-based solutions to these issues. So the 2022 VFS virtual webinars, talk shows, conferences for senior citizens, and keynote presentations, general sessions, and all future workshops will focus on supporting health and self-care for seniors and their caregivers and individuals with dementia or without dementia across the globe. Today's topic is benefits of chiropractic care for seniors. Seniors, as we know, they suffer from arthritis, decreased flexibility, poor balance, even joint degenerations. So chiropractic care, most of us might know, it's an essential cornerstone for both preventive as well as, say, palliative care. As adults age, their health begins to decline, and it is more essential that, they safeguard their health with regular chiropractic maintenance. So to know more benefits of seniors in this line, we are taking, and VFS is taking a pride today to even be able to talk with a wonderful chiropractor today. So we have with us today Dr. Mark Medeiros, who has 30 years of experience in the chiropractic profession. He began his chiropractic education at the National College of Chiropractic in Lombard, Illinois in the year 1986, and he obtained his Bachelor of Science degree in Human Biology and his Doctor of Chiropractic degree in April of 1990. He obtained his license to practice chiropractic in the state of Massachusetts in the year of 1990, and also in Rhode Island in the year 1991. Dr. Medeiros has held chiropractic positions in both Rhode Island and Mass for over past, I think, 30 years or so, and he has his own private practice in Attleboro in the state of Mass. Actually, of particular, I would say a little bit information more about Dr. Mark is that, the associate, he also has, I think he has a 9-year associate position at the chiropractic office in Providence, which he ran daily operations there. And he currently resides in Providence with his wife and 2 beautiful teenage daughters. So welcome, Dr. Mark, to our Volunteering for Seniors today. And we have a lot of questions to ask you for our seniors.
Oh, thank you very much. Look forward to answering them.
Thank you. The very first question I would like to ask you is, which is a very general question, what is chiropractic?
Chiropractic is non-surgical, non-drug. And what we do is we work with the spine. And basically what we do is we remove nerve interference. People that have a chiropractic issue usually have vertebral segments in their spine that have become misaligned, or what we call subluxated. And it causes pressure on the nerve, and the nerve gets interfered with. It doesn't send out its appropriate signal, so that you can get muscle spasm, pain, joint dysfunction. And what we do is we look to remove that nerve interference by properly aligning the segments in the spine that have become misaligned.
So basically coming to the general part of the chiropractic, how are senior citizens, how do you think they can benefit from chiropractic?
Well, as we get older, most of us, even myself, I'm 56 years old, start to get some degenerative arthritis in our spine. I have a little bit in my neck and a little bit in my lower back. And I believe it would be a lot worse had I not received chiropractic care over the years. Um, the studies show that when somebody has arthritic joints, if they don't get any movement, that's not a good thing. If they get too much movement, that's a bad thing. It can irritate the area. But if they get a moderate amount of exercise movement, it tends to prevent the arthritis from getting worse. And the other thing that helps is an arthritic joint, the joint surfaces are not smooth anymore, they're rough, and the vertebrae can get locked up more easily. So by doing an adjustment on an arthritic joint, you're helping it to keep good movement, and you're also preventing the arthritis from getting worse. Because if you can keep the joint moving properly and also, tell the patient that a moderate amount of activity is good, we can try to hold it where it's at so it won't get worse.
So Dr. Mark, why chiropractic for seniors? It actually matters to quality of life.
Well, I've seen a lot of seniors over the years, and their first line of choice is to see a medical doctor for a musculoskeletal problem. And typically they're put on medication, they're sent for physical therapy. And because a lot of seniors tend to have arthritic joints in their spine, the thing that's not being addressed is the misalignment or the subluxation in the spine. So when they go to physical therapy, it really doesn't work out for them, because the physical therapy people work with the muscles, and physical therapists can't adjust the spine by law. All they can do is work with exercise and helping to condition and strengthen muscles. And a lot of the medications that medical people prescribe, anti-inflammatories, muscle relaxants, they only work temporarily. And there's other things that we can recommend nutritionally for people that have degenerative arthritis that can help slow the process down. And in some cases, actually help it heal a little bit so it's not as bad.
But then, my next question is like, how often, should a senior person or any other general person, not just seniors, they get adjusted by a chiropractor?
Right. Well, when somebody initially comes in, usually they're what we call acute, meaning that they have a problem that's really bothering them. It's causing them a lot of pain and discomfort. And a lot of times they've had the problem for several months or many years. So initially it can take time to get things to calm down. So when they initially come in, I might see a patient anywhere between 3 times a week to 2 times a week for a month, reevaluate them, see how they're doing. But my goal with each and every senior patient is to get them to a point where they're feeling reasonably well again. And we see them periodically. It might differ for some seniors as opposed to others. I've seen some seniors that have a little bit of arthritis, so they don't require as much care. Then I see some seniors that have quite a bit, and we have to see them a little bit more often. Typically, I would like to see somebody like once to twice a month. Sometimes we need to see a senior weekly once we get them stabilized, depending upon the degree and amount of arthritis that they have.
Okay. And is it safe, for older adults who have back pain?
Yes. We take x-rays on folks when they come in to see what the structures of the spine look like. And when we do that, we're ruling out any contraindications. One thing we have to look out for in seniors, especially with women, is osteoporosis. If somebody has really bad osteoporosis, it might change the way I do my adjustment. My adjustment might be a little more gentler. I might want to do what we call some mobilization technique, where I'm not doing like a specific adjustment to a certain segment of the spine. because there's a risk of fracture with somebody that has a lot of osteoporosis. But most seniors that come into my office, I do adjust them. And I make sure the techniques are comfortable. And I try to be very specific with what areas I'm adjusting so I don't, overdo it. And we try to keep it safe and gentle.
Also, this is a very general question, which, I have myself, been thinking of. Why is there a popping sound when a joint is adjusted?
Well, each spinal joint has a little bag of cartilage that surrounds it. And inside that bag of cartilage is a little bit of fluid called synovial fluid. And part of the component of the synovial fluid is called nitrogen gas. So it's kind of like when you open a can of soda, the gas escapes. So when we adjust a spinal joint, it separates a little bit so we can get it to move better. And the synovial fluid and the nitrogen component of it makes that sound.
Okay, that's interesting. And,
Yes.
Dr. Mark, what are the benefits of chiropractic care, say for the pre-treatment of, I know there are a few seniors who have this low back pain.
Yes.
So what are the benefits for the treatment for them?
Well, the benefit is we're working on an arthritic joint that has become stuck and locked up and it's not moving properly. And by doing an adjustment to that arthritic joint, we're trying to get it to move better. And if we can get it to move better, we can reduce pressure on nerves and reduce the nerve interference to the muscles and the joints and also the organs of the body too. I've had seniors that have had low back pain and I've worked on them a little bit, and like a month later, they'll let me know, geez, I always have problems with constipation and I don't have those problems anymore. So sometimes we see organic things improve in people. I don't claim, when people come in, I don't claim, oh, we're going to, get rid of your constipation. I had one older gentleman tell me that his eyesight improved, which I found really phenomenal. But stuff like that can happen where we're working on somebody's spine, because the nerves in the spine at each, in the neck, in the upper, middle, and lower back, they all go to the different organs and tissues of the body. So, when a joint becomes locked up and doesn't move properly, and there's pressure on the nerve and there's some nerve interference, that can cause stomach issues, constipation, problems with eyesight. So there are organic things too that sometimes clear up. Although I don't make that claim. When people come in, my purpose is to look at their musculoskeletal problem and work with that. And if they receive any further benefits from that, then that's great.
True. Well said. And how does it help seniors, say, with there's so many seniors with chronic conditions, right? So does it help?
Yes. When somebody has a chronic condition, the main thing that I preach to people, I had an older gentleman come in not too long ago, and the last disc in his lower back was pretty well degenerated. And I told him, this doesn't look good, but we want to maintain what you have, because he's still got some room where that thing can degenerate all the way down, and then it's bone on bone. So what I try to preach to everyone is that, once we get you feeling reasonably well again, we want to continue doing some periodic care to maintain the gains we've made and prevent this thing from getting worse. And also nutritional advice. Usually seniors that have joint problems, we have some nutritional products in our office that can help. One is a glucosamine-based supplement that helps with regenerating cartilage. Another one is for proper joint health. It's got nutrients that support joint health. So what we're trying to do is help them with natural methods so they don't have to rely on medications so much.
Right. That's very informative. And also I want to ask Dr. Mark, because I know I have a father who is having a number of health issues, and fall, one of the major issue for many of the elderly population. So for a senior citizen, we know that a fall could definitely be, it can cause life-changing injuries, right?
Right.
That they never fully recover from. So how can chiropractic care prove to reduce the risk of falling for the elderly population?
Well, another thing that we offer in our office is some what we call progressive rehabilitative exercise, and it differs from physical therapy. Most physical therapy people that I'm aware of, or I've had patients go to, they work mainly with strengthening things. And the first thing you have to do when you're working with somebody that has a problem is do some movement assessments on them to see how well they're moving. Because the first thing you need to improve in somebody is mobility and movement patterns. In the elderly, there could be some balance issues, and there are things that you can do in the office to help with balance issues. One of the things is called a wobble board, where you can even have an elderly person that may not be so stable. You can have them do it while they're sitting. In the wobble board, what you do is you have them sit and they try to balance their feet while they're sitting, both in both directions, doing flexion and extension, and then doing inversion of the ankles. And they can progress with the wobble board. So there are things you can do with balance. You can do balance types of things. You can improve mobility and movement patterns by doing a couple of movement tests to see how well they're moving. So if you can help with balance and help improve their mobility in their movement patterns, then you can start moving into strengthening exercise. It's kind of like if somebody comes in and I observe them raising their shoulder up and they're kind of like, going like this and raising it like that, there's a disturbance in their movement pattern. So I wouldn't want to start them on a strengthening exercise. I would want to start them on exercises that would help improve the movement pattern of the shoulder. And once the movement pattern and the mobility is improved, then I would work with strengthening the shoulder. So we have specific ways of progressing with seniors where in the medical setting, they might get thrown into physical therapy right away. And the thing with physical therapy is they're not getting their spinal joints adjusted. And they've done research that shows that people that get a spinal adjustment, so let's say somebody has a lower back issue and they come in, if they get a spinal adjustment and then they do their progressive rehab exercise after that, it works much better because the adjustment provides neurological feedback into the spinal cord. There are little joint receptors in the spinal joints. And when we adjust them, those get stimulated and it sends information up through the brain to the spinal cord. And we're telling, hey, we want this segment to move. And by doing the progressive rehab exercise afterward, you're further stimulating the nervous system, telling the body, we need movement here. We need to improve this pattern here.
Because Dr. Mal, just now, because you talked about spine, because I know there always, I know a little bit about this decreased joint degeneration, right?
Yeah.
So spine, which is say out of alignment, it's not like a misaligned wheel on a car, right? So can one use chiropractic care for that spine alignment?
Yes. What we do see on x-ray, when somebody has an x-ray, we can actually see vertebrae that are malpositioned. The first thing a vertebrae does when it's subluxate is it goes posterior. It'll subluxate posterior. The second thing it'll do, it'll either rotate to the left or the right. And the third thing it will do is we'll either go inferior or superior. So when I had somebody come in yesterday that had a little bit of a scoliosis in their back to the left side, and it was in their lower back, the lower lumbar vertebrae were not rotated, but the upper lumbar vertebrae were rotated to the left. So when I work on that person's back, I want to work on the segments that have rotated to the left to try to get that back to center.
Interesting.
Yes.
What are the risks of chiropractic treatment? Because it's something which generally we all have the thoughts about that.
Right. Well, when you look at the risk, my malpractice insurance, I think it's like $875 a year. When you look at a medical doctor, you're talking tens of thousands of dollars for a malpractice premium. You know, there are contraindications. When seniors come in, you have to make sure they don't have like an active cancer that's metastasized to the bones. You have to make sure that they're not severely osteoporotic. And you have to make sure that, you know, they're in good general health. So, you know, we rule all those factors out before we begin working with somebody. And I'm big on x-rays. There are so many chiropractors that don't do x-rays on their patients. They come into my office every day. I could think of one older guy that came into my office. He came in on a Saturday morning because his chiropractor wasn't open, and he just wanted me to pop his back. And I had to tell him, sir, I don't know you. I've never had you as a patient. I'm going to do an appropriate workup on you. And when I worked him up, he had severe degeneration of the last disc in his lower back. And I said, no wonder why this thing's bothering you all the time. Has your chiropractor advised you on any nutritional things? Has he advised you on any progressive rehab exercise? And the answer was no. And he went to that guy for over 20 years and never had an x-ray. So x-rays are very important because it lets me see the amount of arthritis that's in there. It helps me rule out if there's any scoliosis, helps me rule out if there's any cancer. I've seen that before. I've had people come in. It doesn't happen that often, but most seniors that come in, I would say a very high percentage of them, like 98, 99%.
And they do cover chiropractic.
Yes. So seniors over the age of 65, Medicare covers chiropractic, but the only thing they cover is when we adjust the spine. They do not pay for progressive rehab exercise. They don't pay for x-rays. They don't pay for exams, which is really, really strange in my opinion. Oh. The only thing they pay for is when we adjust the spine. So initially, when we see a Medicare patient, they wouldn't pay for the initial exam, and they wouldn't pay for any x-rays that we do. And they also wouldn't pay for any re-examinations for like when we want to recheck somebody to see how they're progressing. So seniors have to be aware that, you know, when they see a chiropractor, there is some out-of-pocket expense. And I think it's really something that needs to be addressed. You know, seniors can go to their medical doctor and have their exams paid for and their x-rays paid for. And it's just a travesty that the federal government doesn't pay for exams and x-rays for seniors.
Yeah, but that's a very sad part, you know, because
Yes.
I know so many seniors who do want to go for chiropractic care. And I think because some of them are into the mass health, you know, the state,
Yep.
you know, type of, you know, health systems, and they're not getting paid for that. You know, they have to put
Right.
out of pocket. It's not easy for everyone.
The good thing I will say about the Medicare, though, is what I tell my patients is, quote unquote, unlimited is medically necessary, but it does allow us to do treatment plans with people. I've had seniors that have been very acute, and I'll do 3 times a week care. And once they're better, I reduce it to twice a week. And then once they're, you know, let's say they're much better, you know, reduce it to once a week, and then have them come in like a maintenance schedule, once a month, twice a month, once every 6 or 8 weeks. And what I find is that the Medicare is pretty decent about paying for the chiropractic adjustments over that time frame. So we usually don't get a lot of interference in terms of you know, what we want to do for a treatment plan. The only thing the patient would have to pay for are the exams and the x-rays. But in terms of, you know, getting a proper adjustment plan, I have some people that have Blue Cross plans and they only get 12 visits. So with Medicare, we can get, some visits. In my career, I've only had Medicare audit me once. And the lady that was coming, she wouldn't stop coming. I had to tell her, you're coming too much. And she just walked in whenever she wanted to. Nothing ever came with that. I think what the facility I worked at, I think they returned the money for that visit or something. But I've been doing this for 32 years and I've never had them audit me. I've had some Medicare patients I've treated for 3 or 4 months with an acute problem, and I've never had them interfere or deny any care. So the good news is, I am able to get a fair amount of adjusting treatment. And, some of the Medicare people don't mind paying for extra services like progressive rehab. They won't pay for x-rays. They won't pay for. Sometimes what I'll do if they're in a bind and they can't do x-rays with us, I'll refer them back to their primary doctor and tell them, just explain to your primary doctor you're seeing a chiropractor and that if I do the x-rays, they won't be paid for. But the good news is they usually don't interfere with, how many adjustments. I mean, I'm sure if I saw somebody 3 times a week for a year, they'd give me a problem. But most of the time I can get a decent treatment plan in to get them feeling well again.
But then, Dr. Markey, right now you were talking about Medicare, right?
Yes.
So many patients who are using the Medicaid,
Yes, Medicaid, Mass Health, they cover 20 chiropractic visits a year. They do not pay for progressive rehab exercise. They don't pay for physiotherapy modalities like electrical muscle stim or ultrasound. They do cover x-rays, and they do cover exam and re-exam codes. So that differs from Medicare a little bit, but they limit people to 20 visits a year, which again is a travesty, because not everyone that comes in with a problem, some people might need a few visits. Some people might need more than 20 visits. So if somebody has a problem and it's a really severe problem and I need to go beyond 20 visits, there's no way of appealing. There's no way of getting extra visits out of it. So usually what we do with somebody that has a Mass Health, and if their visits run out and they need a little more care, in Massachusetts, we can give like a small time of service discount. It's legal to do that in Massachusetts. So we try to work with patients on that have a limited insurance plan. All the insurances today are limited. I haven't had anybody come into my office in years now that has like an unlimited plan. I think the best I've seen in terms of visits might be 36 visits a year, which is still not a lot, especially if somebody has a really severe problem. But most of your regular insurance plans are limited too. Some of the insurances will pay for progressive rehab exercise. Some of them will pay for physiotherapy modalities. Blue Cross pays for exams and x-rays. They pay for adjustments, and they pay for one physiotherapy modality per visit. United Healthcare is pretty terrible, but they all vary. And what we do when somebody comes in is we take a copy of their insurance card, and we're not required to call the insurance company. What we kind of do it as a courtesy to find out what the person has for benefits. And we'll let them know up front that, okay, you have 20 visits per year. They pay for exams, they pay for x-rays, but they don't pay for modalities. You just can get adjustments. So we try to let people know up front what their coverage is.
And the seniors don't need to have a referral from an MD, or should they, if they want to come and visit you?
There are some Medicare plans that are administered by different insurance companies. I think some of the Tufts plans require referral, but most of the time, in a high percentage of Medicare cases, no referrals required.
Okay, that'll
But
be good.
there are some
Also-
fringe plans out there where that do.
So this is same for whether Medicare or for Medicaid. It's for both.
With Medicaid, I believe in all instances, they need a referral from their MD. Medicare, no, but some plans do.
Okay. So as you said, like it all varies from whichever plan they take.
Right.
Because for Medicaid, it's done again by federal, so they need to work with an MD.
Yep.
Yeah. So yeah, I think we got a lot of information from you, Dr. Mark, for now. Is there anything else would you want to share with us and let us know, or something that you would say that would be beneficial for our seniors who are listening?
Well, I would say that, seniors that come to my office will sometimes kick themselves and say, geez, I should have come to you years ago. And,
Yeah.
The thing I tell them is I go, well, you're here now, let's see what we can do. And a lot of times we can help. And I'm upfront with people when they initially come in. I tell them, the purpose of your visit today is to see if I can help. If I think I can help, I'll let you know. If not, I'll also let you know that as well. So, we do an appropriate exam and x-rays, and we let them know right up front if we can or cannot help them.
Absolutely. That's wonderful. Thank you so much, Dr. Max, for joining us.
You're welcome.
I want to thank you for your time and also for sharing so much information. I would like to tell this to all the viewers that chiropractic care has, as Dr. Mark was explaining now, has its own pros and cons, each of which needs to be weighed in conjunction with an elderly person's overall health and wellness. Chiropractic will, I'm very sure it'll continue to gain traction as it is very safe and effective way to address many, many kinds of illness. The best way, is to determine if chiropractic is safe alternative for you or not, is to definitely seek approval of one's personal physician if possible. And on behalf of our entire Volunteering for Seniors team, I want to thank you all for listening, and we look forward to bringing you more top quality content for our seniors and their caregivers. So we at VFS believe that unless members of civil society are involved proactively in the process of development, sustainable change will not happen. So we encourage and invite volunteers to be an active part of our organization and share the same vision and purpose as us. Thank you very much and have a wonderful day.